Hey guys, it is Nicole again at 16 weeks and 5 days pregnant. Today is October 2nd, and I had my doctor's appointment today. Everything went really well. The baby's heartbeat was normal. I gained 9 pounds. Not very good. Not very good at all. It's too much weight in only 16 weeks. What else was normal? Pretty much everything was normal. My blood pressure was normal. The only thing crazy was the weight gain. And she didn't say anything. She said, "Oh, you're gaining weight a little bit quickly." I said, "Yeah, 9 pounds already." So I said, "That's too fast." And she pretty much gave me this is baby number 2. So everything seems to be moving rather quickly. I asked her, should I be feeling him at this point, him or her, because we don't know the sex yet. And she said that most of the times with baby number 2, you're able to feel the baby a lot sooner than baby number 1. And before, I don't know if I mentioned this in an earlier video because my videos have been so far and in between. I mentioned to her that since I've had Phoenix, even up to maybe 10 months, a year after having Phoenix, I could still feel my muscle and my muscles moving in my stomach area. And she said, "Oh, that's pretty normal. It's either your muscles are moving because after you have baby number 1, your muscles are contracting. Your uterus may still be contracting. Who knows?" But she mentioned your muscles may still be moving, or it could be the baby moving, because at 16 weeks, between 16 and I think 23 or 25 weeks, you should start feeling the baby move, or it could be just gas. And I'm thinking maybe it's the baby moving. It's just a little fluttering. Sometimes it feels like it's an elbow or a leg or a foot in my side. And it's just for a quick moment. It's not like they'll lean up against me and stay there. No, it's nothing like that because the baby is still rather small. So I just wanted to get her input and see what she had to say about that. And I was pretty satisfied. So that's pretty much it with my doctor's appointment. Went pretty well. As usual, it's very, very quick at this time. I had to switch my OBGYN office because I was with, which insurance did I have? I think I was with Empire. I had Empire, Blue Cross Blue Shield, HMO, and it went from $90-something between, I think it was $70-something or $90-something before I had Phoenix, and when we became a family, it went up to $233 per pay period. So every other week, I was shelling out close to that, $233. So no way was I going to be able to stay with that. So then I switched to HIP, but HIP, I think it's HIP Prime HMO. But unfortunately, the gynecologist that I was with, that office I was with, which they were pretty good. I liked them. They're very thorough. It's Dr. Lucy Gade. I'm not afraid of, revealing any of that. But they didn't accept HIP. So I started doing some research once I kind of had a feeling that I was pregnant. And I forgot which doctor it was there, but I found Cityscape because I was looking for a PCP, a primary care physician, because my eye doctor wanted me to go see a specialist, but I can't go see a specialist unless I get a referral. And I think that's pretty standard with any health insurance. So finally I said, well, let me start looking for a PCP. And I did find one that was open on Saturdays, and I think they're the ones that open on Saturdays, not my OB. But I just put in the zip code that I was looking for because my PCP didn't take HIP either. They took HIP POS, which is $400 and something a pay period. I don't think so. So I found a PCP. I did call them. However, I did not. I just called to get some information on the office, but I did not schedule an appointment. I didn't become a new patient. But then I found Cityscape because I put in the same zip code. I said, oh, well, I want all my doctors to be in the same area. So I put in Cityscape, and I originally wanted my delivery hospital to be New York Presbyterian, but they're with NYU. So I said, let me just check them out. I filled out a form. I think it was a Monday. The lady called me that afternoon. Front desk called me that afternoon and set up an appointment with me for the next day. So I was so surprised that I got an appointment so fast. And I went to the office, and it's so nice. Cityscape OBGYN. You can find them online. They have a website. They have all the things online. It's just like with Phoenix's pediatrician. And I think they're so awesome. So far, I've seen Dr. Martin. I've seen Dr. Archibald. And this next time I go, I'll be seeing Dr. Soskin, I believe that's her name. It's a group of women who are in this practice. I don't think any males are there, but I mean, it's your preference. I really didn't care if it was male or female. I just wanted to be in the area because it was easier for me to get to, and just wanted to check it out and see how they were. And so far, I loved it. Even though I wasn't a pregnant person when I signed up with them, I was seen rather quickly. Usually at your OB's office, you're at least waiting for 15-20 minutes, but they take you right away. Especially being a pregnant patient, I arrived before my appointment time. They took me. My appointment was 2:45. I was out of there by 3:09. So that was rather quick for me. She came in, she talked to me, listened to the heartbeat. She asked if I had any questions. She went over anything that I wanted to know. I wanted to know what medication I could take because I had a really bad headache last night. And she said, well, all you can take is Tylenol. And I said, I knew that, but I was hoping she would say I could take something else too. But just Tylenol. The nurse came back in. She drew blood, and that was pretty much it. And they have late appointments, so I prefer my appointments to be after 4:30, because that way if I need to pick up my daughter, I can pick her up in the afternoon because my appointments aren't that long. So I like them. If you're looking for a new OB, check them out. They're pretty good. Well, they're all pretty good with pregnant patients. I'm gonna see how they are after we have the baby. So anyway, guys, that was my update. I will see you next time because I really don't have anything else I need to share. Baby's fine, mommy's fine, Phoenix is fine. She's not here, so I'm able to do this video rather quickly, and Chris is still at work, so it's just me. So anyway, take care. See you guys in the next video. Bye.